friends, it's me, Annie, your friendly health coach. Welcome back to my platform. Let us learn about hepatitis C today. If you are missing something about hepatitis B, please visit my previous videos on my health and well-being on all social media platforms. Let me briefly explain the difference between hepatitis B and C. Hepatitis B and C are different viruses, and it is possible to be infected with both hepatitis B and C at the same time. Hepatitis B is transmitted through blood and bodily fluids, while hepatitis C is usually only transmitted through blood. So let's get started. Hepatitis C is a viral infection that affects the liver. It can cause both acute, which is short-term, and chronic, which is the long-term disease. It can be life-threatening. Most people who have recently been infected with hepatitis C have no symptoms. Some people have yellowing of the skin, which is jaundice. A chronic infection often causes no symptoms. However, fatigue and other problems may occur. People with a long-term or chronic infection often have no symptoms until their liver is scarred or cirrhosis. Most people with this condition are ill and have many health problems. The symptoms are your urine will be dark and you also have a clay-colored sores. Other one is you will feel tired, you will have fever, joint pain, you will lose appetite. Another symptom is nausea, stomach pain, vomiting, yellow skin or eyes, jaundice. In case you are wondering how hepatitis C is transmitted, the hepatitis C virus is a blood-borne virus. It is most commonly transmitted through the reuse or inadequate sterilization of medical equipment, especially syringes and needles in healthcare settings, the transfusion of unscreened blood and blood products, and injecting drug use through the sharing of injection equipment. Hepatitis C can be passed from an infected mother to a baby and via sexual practices that lead to exposure to blood. For example, people with multiple sexual partners and among men who have sex with men. However, these modes of transmission are less common. I know you may be wondering whether hepatitis C is curable. The answer is yes. Modern treatments can cure hepatitis C in most cases. These treatments include a combination of antiviral medications taken for 8 to 24 weeks. However, because many people with hepatitis C do not know they are infected, they may not get tested and treated for many years. There is no vaccine to prevent hepatitis C. The best way to prevent hepatitis C is by avoiding behaviors that can spread the disease. The hepatitis C virus can be transmitted only through blood, but exposure to tiny amount of blood is enough to infect you. I would like to give you some good tips on how you can reduce the risk of contracting or spreading hepatitis C virus. Number 1, never share needles. Intravenous drug users have the highest chance of getting infected with hepatitis C because many share needles. Besides needles, the virus may be present in other equipment used with illicit drugs. Even sharing a straw or dollar bill when snorting cocaine could transmit hepatitis C. Bleeding in the nose frequently happens when taking cocaine this way, and microscopic droplets may enter the straw and be passed on to the next user even if they can't be seen. And the next one is avoid direct exposure to blood or blood products. If you are a medical worker or healthcare provider, avoid coming into contact with blood. Any tools that draw blood in the workplace should be thrown out safely or sterilized to prevent hepatitis C infection. My next tip is don't share personal care items. Many items that we use on a daily basis will occasionally be exposed to blood. Often, people will cut themselves while shaving or their gums will bleed while brushing their teeth. Even small amounts of blood can infect someone, so it is important not to share items such as toothbrushes, razors, nail and hair clippers, and scissors. If you already have hepatitis C, make sure you keep your personal items such as razors and toothbrushes separate and out of children's reach. My other tip is choose tattoo and piercing parlors carefully. Only use a licensed tattoo and piercing artist who does the right sanitary procedures. A new disposable needle and ink well should be used for each customer. If in doubt, ask about their disposable products and sanitary procedures before getting a tattoo or piercing. And my final tip is practice safe sex. It is real for hepatitis C to be transmitted through sexual intercourse, but there is a higher chance of getting hepatitis C if you have HIV, another sexually transmitted disease, multiple sex partners, or if you are engaged in rough sex. Let me say this. Hepatitis C is not known to spread by casual contact such as kissing, hugging, breastfeeding, sharing eating utensils, coughing, or sneezing. If moms have hepatitis C and their nipples are cracked and bleeding, they should stop nursing until their nipples have healed. Always consult your doctor first if you have any health concerns, and do not forget to take good care of yourself. If you have any questions or comments, please leave them below. If you enjoyed this video, please remember to follow my page and share it with your friends. Thank you, and hey, bye.